I am Dr. Narda Robinson, and I'm happy to have you here. Today, we're going to be talking about scientific integrative medicine and ways to abate stress and strengthen success, whether that's in your own career, with just how you're going to survive, or whether it's going to be the results that you get with your patients. So, as we get started, I have some bad news, some good news, and then some even better news about your stress. So, first, the bad news. We're stressed, really stressed. I mean, I think I'm maybe relatively not as stressed as those of you that are having general practices to run every day and then trying to get your pain medicine and your integrative medicine and maybe your rehab working and all that together, and especially if you're in a corporate environment. So, by the time you get to my age, you might have been able to institute measures that got you where you really wanted to be, and you're happy, and you've reduced just all the annoying things in life where you thought you should do something for somebody else's sake or whatever. You've just carved your own niche. So, but in general, as a profession, word has gotten out that we're pretty stressed. And true to form, overachievers, and I will tell you why. Just yesterday, this came out from studentloanplanner.com. I think today is the 27th, yes. And so they came out with the 10 worst jobs for mental health right now. And they looked at them in terms of your concerns about the economy as well as the coronavirus, which you can imagine are these little things all floating around here, which you are avoiding with good mask wearing. So the 10th from 1 to 10, number 10 was dentist. And, we're accustomed, I think, if you hear polls and surveys and everything, dentists are pretty stressed, and you can figure out why. I mean, it's I can't see where it's that much fun to do what they do. I mean, it might be okay, but with the person quotient and all the fear and everything and what you're doing, it doesn't seem like the happiest thing. But a lot of dentists did have to close down, and so they were quite worried about their income. And I believe that veterinarians fared better in that regard because we were considered and are considered essential workers. Then there are pharmacists, and pharmacists tend to get pretty stressed because there's so much competition, and you have to work so quickly, and you have people's lives in your hands, and so the pharmacists and their pharmacy extenders and all that. So they have quite a bit of stress too. And then you've got your nurse, and we've heard all about nurses and PPE and just in general, there's a huge amount of stress on nurses. Number 7 is physician's assistants, kind of the same thing, also not knowing where they kind of fall, and a lot of private practices have had to shut down or go to telemedicine, so there's been a lot of stress from an income perspective and with the coronavirus perspective going on as well. And then optometrists, I don't see how this can't be scary to look at day after day, but I guess you get used to it. But optometrists, they too had to either shut down or just do emergency only, so they suffered quite a bit of stress. Number 5 are counselors, and you can imagine that and everything because we also have social workers on this, which we'll see. Nonprofit professionals because donations are going way down, like even to animal places, zoos and shelters and all that. So then you've got your social workers. So people that are being relied on to help others get through this, they are enduring a lot of stress themselves. But then you get to number 1 of the worst mental health careers, which is veterinarian. So that's where the overachiever, stands true to form. And then when you think of it, aren't we all of these things? Dentists, I mean, it depends on your practice, but you do dentistry, you dispense drugs, you have all these health things. You might be a physician's assistant in terms of people are asking you about their own problems. I know that happens to me, maybe for different reasons, but all these things. And you look at eyes as well. So we have the love of animals, the economic pressure, this whole thing with the COVID, and then our clients, which are quite stressed as well. And I am seeing ever more clearly the divide between integrative practitioners and those that are also doing rehab and just involved in animal care in a more partnership way with clients versus those who I've been keeping in touch with that are working at corporate institutions. And it seems like there's just so much pressure to even more than before press the surgeries, the high dollar procedures at the cost of the stuff that these people like to do, which is the pain medicine, the integrative approaches, and all that. So it brings into even more stark contrast what it's like to have your own practice or work in an environment where your needs and what you want to do are supported, and that you are able to reach out in a loving, careful, safe manner to your patients and the clients, and just to do the medicine you love to do and not to be referring them for things that you may increasingly have problems doing. So that's what we're coming into this with, and that's why I'm doing this webinar today, is because a lot of people and students have been reaching out, like, what can we do to calm stress in ourselves? And, my go-to thing is typically quit corporate, but maybe you're not ready to do that anymore. Maybe you're a student and you're still thinking about the idea like, $20,000 signing bonus. That's not bad, but I know school debt and everything gets you, but we've already gone through this before about the value of having a small practice and being on your own and all that stuff, or being in with friends and everything like that. So that all holds true. But wherever you are, even perhaps if you are doing an integrative medicine and rehab practice, that it's still, you hear it all day long: uncertainty, foreseen things, and never before and have we seen something like this. So there's a lot of stress out there. But now, what's the fallout if you are experiencing it, even if it's something unrelated to your career? What happens, like quarantine? That's been for a lot of people, especially the people in my online courses, where they have all this time to complete things, but they have little ones or irritating people living in the house, and it's just hard to concentrate. And so there can be unmitigated chronic stress from that. So I get it. So, what are some of the typical problems that happen when you are chronically stressed? Obesity, heart disease. So, you can think about all those catecholamines and just the neural circuitry that is driving your cardiopulmonary system. Cognitive decline. Have you ever tried to take a test when you're really, really stressed? I know with the acupuncture course, for people that just get this crazy amount of test anxiety and performance anxiety, they that's what makes them have more trouble with the test than remembering where the points are and where the nerves are. So that's there. Your diabetes mellitus gets out of whack. It worsens depression, digestive conditions, asthma, as does pollution. So we have a convergence of all kinds of things. You have work, family, just whatever's going on with home and the environment. Do you live in a polluted area? Can you get out? Can you exercise? What do you have access to? What can you do that's financially feasible? So all these things that come to bear on your psyche and your body, but then how can we, for you and for your patients or your clients, how can we make things accessible so that they don't have to either be asking for drugs in the human field, opioids for chronic pain, in the veterinary field. I asked at some point during here, like, how many of your patients are having this extreme stress or even just chronic underlying stress? I mean, just think of it. You're stuck in somewhere, usually either inside or outside. Maybe you can go in and out and it's protected. But as an animal being cared for by a human or poorly cared for or whatever, the exponential amount and multiplication of the stress that we might feel, like if I haven't had a Starbucks or something today, but just like their food is predetermined for them, their exercise is largely predetermined, there's stress in the household, or a scary person that is, under quarantine with them. Is there a smoker? Are there other animals that are aggravating you? And it's just this inescapable thing. So I think that as compared to a human practice, I mean, a veterinary practice and our patients, that level of stress seems to me to be like such a bigger deal than we're ever taught to look at. And then when it comes to pain, I mean, when your nervous system is all revved up, whatever species you are, that's going to worsen your chronic pain as well. And then that decreases your mobility, et cetera. So when you think of it for your own life, what is your response to stress? Might it be headaches, migraines, tension headaches, from a number of causes. And then for migraine especially, you have changes in your brain function. Or are you somebody that brings it down into your digestive tract and you get irritable bowel syndrome or some other manifestation from a digestive standpoint? And again, like I said here, which illnesses in your patients have a stress component? So, how much time do you have to talk to the clients and get to know them? Not much, probably, if you're in a corporate practice, but how well do you know that family? If you are or you've had a mobile practice, then you get to see what the living conditions are like, which is hugely eye-opening. And hopefully we can get back to that in a more regular basis because you see so much when you go into the home that you never learn when they bring an animal to you. And especially if you're in a practice where you just walk into a room and the animal might be on a table or wherever they are, you don't see that animal move. You don't see them come in and out of the building, the interaction between the person. And so now that we bring the animals in and we don't let the clients in, we're missing out on that. And that might be where telemedicine can give us some insights where you have the screen there and you kind of see what kind of nonsense is going on in the background and what the animal's reactions are in situ. So that might be something to attend to a little bit more if you haven't been doing that. And so when we think about this pervasive issue with stress and wonder, well, A, was it covered in school? Nowadays with all the suicide and burnout and depression talk, there is more discussion about that happening in school, but there's not really any meaningful intervention or ways of coping that to me look like what's needed because it's all, as I've said before, just a band-aid. If you're not going to address what the true cause is, which is this just degradation in how human and veterinary medicine is carried out, and that depersonalization from the caregiver to the recipient, to the human, either it's a client or patient. And so much just needs to change. And that's why I and the people in this community do what we do is because it just feels better. It felt better right from the start, even when I was in medical school and came down to neurosurgery or acupuncture. And I just really looked at who do I want to be. And that set the framework for the rest of my life professionally. And so I see that, and I see that especially in students where if you don't see an option, if you don't know that there's a whole path out there that is waiting for you that you could thrive in and make a good living in, then you can get sucked down into the devolution of of a lifestyle that you might not be that happy in ultimately. So, you know, with this person with a migraine and a cold pack, do pharmaceuticals fix stress? Not really. They may blunt it if what depends on human, what are you using? You might be using a migraine medicine for your migraine, which is not that great and it has consequences and it's not wholly effective. You might get hooked on Xanax or Valium or maybe cannabis or opioids. So there's relying on a crutch, which is not to me ideal. There are other things that you can do. So we often think during this series, like, okay, we have drugs and surgery. That's your standard pathway. Or we have complementary and alternative medicine, what it used to be called, which is integrative medicine now, or scientific integrative medicine, which has so many different mechanisms of action and opportunities to encourage the intrinsic healing mechanisms to get more robust if they've been depressed and help you and your body heal, psyche and mind and body. So does surgery fix stress? Yeah, that's kind of laughable, isn't it? But anyway, so that was all the bad news about what stress causes and how unmitigated stress will mess you up and maybe messing up your patients too. But here's the good news. Probably not a surprise, but scientific integrative medicine can help. So we have medical acupuncture, medical massage, photomedicine, botanical medicine, and integrative rehabilitation, which we'll talk about as exercise. So integrative medicine, from a scientific, rational standpoint, you don't have to click your heels to go anywhere to Oz. No wizards need apply. It's just common sense, rational, evidence-informed, scientific integrative medicine. So that's what we're going to be talking about today. And largely what I'm going to be doing is going through a series of research studies, just looking at the surface, at the abstract, at the conclusions, at a little bit of the methodology, mainly to drive home the point that there's a lot of robust research from which we can draw and have ideas as to how we can seek treatments that will be effective for us and for our patients. Because if we don't see our patients without that context of stress, then we can't really separate out what's what. And I think that when we educate our clients with some ideas that we can extrapolate from the human, then the clients will get a clue like, oh, yeah, the television is too loud. I listen to X news channel all day long, and that's just never stopping, and my husband's yelling all the time about this and that, or the dog's always barking, and why is my cat all stressed and pulling out her hair? So I think it's important to keep right at the top of the list. And of course, if you have a job that you have 5-minute intervals or 15, you're just not going to be able to dig that deeply. So next webinar, we're going to have on the Prima program and a Prima way of life, Prima way of practicing. And in that, we will go into these modalities more and see how, for certain conditions, how they will give you so many more modalities to choose from and so much of a richer effect therapeutically. So I always ask this, might some of this have been helpful and effective to learn in veterinary school? Yeah, I know the curriculum's crowded, but you want to learn how to treat stress or do an amputation? I mean, how many amputations are you going to be doing? But anyway, so let's begin with medical acupuncture. Here is somebody just positioning a needle at large intestine 4, which is midway along the shaft of your second metacarpal in the belly of the first dorsal interosseous muscle here. And so that's large intestine 4. That is speaking to, depending on how deeply you insert the needle, that can speak to every nerve that comes through the brachial plexus. So we have our radial, which innervates in the human, the skin. The ulnar nerve supplies the first dorsal interosseous muscle. If you go deeply, we reach the thenar eminence, which is median nerve innervation. And then also throughout here are nervi vasorum that are supplying that double arterial arch system in the palm and have links to the autonomic. So it's considered the most powerful point in the thoracic limb. And so with that knowledge that we have an opportunity to look at acupuncture for ourselves and for our animals, let's go shopping online at pubmed.gov. And first thing, we're going to think about acupuncture for emergency visits. So here in this one, this is 2019, so fairly recent, utilization of acupuncture services in the emergency department setting, a quality improvement study. And I've seen this a whole bunch, even when I brought my parents in the past to the emergency department, and it's just, yeah, even if you're coughing, yeah, probably you need opioids. Even if you have a stomach ache, probably you need opioids. So it's been a long course, long time coming of a big problem, and we had this opioid epidemic till we got this pandemic going, and so opioids haven't been talked about quite as much, but it's probably even a bigger problem now. But looking for things you can do rather than reflexively script out opioids for pain. And here looking at acupuncture as a non-pharmacologic treatment involving the insertion of needles into the skin or tissue at certain points in the body may help to decrease acute pain. So here they were looking at acupuncture for acute pain management in the emergency department. And this is almost 400 patients that received the acupuncture, and mean pre and post acupuncture pain scores significantly differed. So I have so many studies I wanted to talk to you about that are just taking out the nuggets here. And so before and after they got acupuncture, they had really different scores, but receiving opioids during the emergency department visit was not associated with improved pain scores. Also, with acupuncture, stress was reduced, anxiety was reduced, and nausea was also improved. So, that's pretty straightforward that acupuncture significantly decreases pain, stress, anxiety, and nausea in the emergency department. But even with results like this, and, you know, obviously known problems about opioid overdoses, and dependency and addiction, it's hard to get changes in this entrenched system. You pretty much need somebody in the vicinity, one of the physicians, and if it's a training group, it has to be like one of the head residents to be proactively recommending acupuncture, reminding people because it's just this endless gear kind of thing, and you need to neuromodulate the people involved and the staff because the evidence is there. It's just changing human behavior. So that might be in your, professional surroundings as well. Maybe you could be doing a lot more treatments than you are, but you're restricted because of the milieu that you're working in. Again, why it's important for you to be able to call the shots and you determine the quality of medicine and the type of medicine that you practice. Okay, this is of interest to students and maybe others, the effect of acupuncture on working memory and anxiety. As I said, we know how when you're anxious, you just don't think as well. It's really hard to remember things, even maybe the password on your phone that gets into your password stash. So it just knocks out your brain. But here they investigated whether acupuncture could improve memory and reduce anxiety. And they use these different measures for the human state trait anxiety inventory, and this automated operation span task, a computerized test of working memory, and all that. And so the acupuncture group scored almost 10% higher than the control group and committed fewer math errors. And acupuncture subjects also reported lower state anxiety after intervention than control subjects. So here we have a way to reduce the anxiety that disables your cognitive capacity. And indeed, we find frequently that when we have somebody at the medical acupuncture course that is having problems passing their hands-on exam because of their performance anxiety, that I give them a little bit of a GV20 in the head if they want it and they're not pregnant, because we're not going to induce abortion, but we don't want any medical legal problems. There it is in the doggy. GV20, okay, and um, and that's what we do. But what did they do in this study? We have select acupuncture points, and how did that work out? Had to dig a little bit for these. Acupuncture points were inserted for 20 minutes. Didn't say that there was any stimulation. Oops, fuzzy from you, little kiddo. Any stimulation or electroacupuncture. Looks like it was what we call dry needling. So Si Shen Kong is actually a group of 4 points on the head that I showed you this point just now, GV20, governor vessel 20. So Si Shen Kong is 4 points around that. It's hard, it's like right in here. And that's stimulating still many of the same nerve branches, the trigeminal nerve branches and the upper cervical nerve branches here that all crosstalk with the vagus. So it's going to have relaxing effects. GV24, if you want to find this on yourself, you can. Then, so we went from GV20 at the top and 4 points around it, which were Si Shen Kong. GV24 is just midline right here at the hairline. GV24. So we're getting frontal nerve branches from the trigeminal nerve. Again, crosstalk with the vagus and relaxing. Then we're getting Yin Tong, which is right between the eyebrows, right there. See? And with us, we actually do have eyebrows that you can see. So right there, yin tang. In my acupuncture book for humans, it's GV 24.5. This is significant. We will see, I believe, well, we'll see in more studies that dimension yin tang. But when you furrow your brow and you get a line right there, that's not good, right? And so if you do your face could freeze like that, and then you get a wrinkle there. And so with any of the wrinkles, crow's feet, just as an aside, a facial tip, you got to use that connective tissue to your advantage and stretch out those squishy facial expressions that you've been doing. Same thing with here. If you've got a frown line, go like that. And this is also a good point that I use in a different fashion. But when with cats with respiratory conditions, I open up this frontonasal suture and all that tissue in there, and we get some reflexive effects there. But anyway, that's the point. But if you feel it and you feel like the tension from your procerus muscle and like glabellar in there, then that's like extra good to try on your own. Heart 7 is at the wrist. Pericardium 6, three finger breaths right there. You fall into a hole. Kidney 3, can't show you on myself without tipping over, but that is right here on the doggy. Kidney 3, right there. But if you learn the acupuncture, then you'll know that really well. Anyways, the control group had acupuncture points touched and swabbed with alcohol, but no needle insertion. So yeah, there's some questions a little bit about the control, because it's definitely going to differ if you have a needle. And so are those points, they're good points for anxiety, but if you did the same stimulation at different points. So the acupuncture research can be endless in that way. Here, another study, 2018, effective acupuncture or massage on health-related quality of life of hemodialysis patients. And that's stressful. I've had hemodialysis patients before, and it's just awful. And so for a lot of these, we won't go into the exact acupuncture treatment because we're just looking at sort of proof of concept that scientific integrative medicine has value for a lot of different patients with a lot of different conditions. And where are you going to find pharmaceuticals and, of course, no surgery for these problems? And so this is a niche that is special made for this kind of work, and finding that it showed a trend toward improvement in overall quality of life as determined by this scale. Statistically significant massage and acupuncture. Yes, I mean, just do that by default unless proven otherwise it's not needed. And then this is your quarantine thing going on for a lot of you. Acupuncture for treating anxiety and depression in women, a clinical systematic review. This was interesting because in their conclusion, in their 6th reviewed study, there was high level evidence to support the use of acupuncture for treating major depressive disorder in pregnancy. So I'm not sure where pregnancy came in, but we'll see. The pregnancy is one of those things that does up the ante of stress in your system. And then this is, again, the yin tang point right here. A randomized controlled trial examining the effect of acupuncture at yin tang on preoperative anxiety levels in neurosurgical patients. And this is out of anesthesia. So that's pretty cool. And neurosurgery, they're not talking about your finger nerve. They're probably talking about either your back or neck or brain. And so here is a typical massage or facial kind of approach to work again some of those frown lines there, but yin tang would technically be right in the middle there between the eyebrows. And so, yeah, preoperative anxiety, if any of you have felt it, is unpleasant. It's a source of psychological distress that occurs in up to 87% of patients. What is wrong with the remaining 13% that they are not feeling anxious? What did they do? Maybe they took some cannabis that they didn't report. But anyway, sedative medication is undesirable due to the need for early postoperative neurological assessment. So we are talking brain. Acupuncture has previously been shown to reduce preoperative anxiety, but studies involving neurosurgical patients are lacking. And so here they did the single center prospective randomized controlled trial to determine the effect of acupuncture at yin tang on preoperative anxiety levels in neurosurgery patients, and went on looking at baseline anxiety, looked at state trait anxiety. There were no adverse effects in either group, and they found that acupuncture at Yin Tong reduces preoperative anxiety levels in patients awaiting neurosurgery. Cool. So why aren't we systematically employing that before surgery? It's just like for the dogs with IVDD, the dachshunds, and that study out of University of Florida several years ago now that showed that the dachshunds recovered faster if they got, well, they did hemilaminectomies on all of them, unfortunately, but the dogs were walking faster and they were just doing better right away. And so why aren't we just routinely using appropriate, not hyper intense photomedicine standardly for spinal cord injury, whether or not they get surgery? That's another webinar someday. Here, acupuncture on stress related drug relapse to seeking. But, anyways, stress, drug addiction, acupuncture has been proven to be effective for reducing drug addiction, drug seeking, and stress related psychiatric disorders such as anxiety and depression. And even with migraine, it corrects reversible brain malfunctions. Migraine is just your brain, your nervous system in the brain going haywire, and it can be triggered by a bunch of things, and that's another webinar is migraine. Anyway, furthermore, acupuncture has been shown to correct the malfunctions by regulating drug addiction and stress-related neurotransmitters. So it's working on a lot of different levels on brain networks and brain systems, endogenous pain mechanisms. So, so that is a protocol for what they want to do going forward. Acupuncture in oncology. The effectiveness of acupuncture may not depend on needle retention duration. And this is interesting too, where they were looking at whether it made that much of a difference if you had the needles in your body for 2, 10, or 20 minutes, and showed that essentially people were fine with anything. And that's true even if you're doing trigger point work. A lot of times it's really when you're getting the acupuncture in, you're having a connective tissue effect and a wide ranging just fascial relaxation. You're getting the muscles changing their firing patterns on those trigger points. And really, people much thought it was good no matter what. And 95% of them indicated that they would recommend acupuncture to other cancer patients, friends, and their family members. So you don't need to spend forever. And that's something useful for you to know when you're in your clinic and you have critical care patients or whoever it is, or if you don't have much time to do acupuncture. It's like really just do a little bit. Just do a GV14, GV20. Those are you that are here that are from my acupuncture course. You can get a lot of effects. And similarly, if you use some massage, just somebody touching you and stroking your back, I mean, it can make a world of difference. Here in migraine, which is a stress result, acupuncture as prophylaxis for chronic migraine, a protocol. So here's another protocol, and just looking at how they can change the incidence. And here in another study, acupuncture modulates the abnormal brainstem activity in migraine without aura patients. So there's so much research done on migraines. And yeah, it can be worsened by hormonal shifts and everything, but stress is a big amplifier, and especially neck, head, shoulder stress. It's rare to not find that in people that even would come in and say it's from hormones and blah blah blah. Anyway, so with this study, they could see that with Verum, the true acupuncture versus the sham or the fake acupuncture, that they differently modulate different brain regions and suggest that how are they going to fix this dysregulation in the big system that triggers this brain just nonsense firing going on. The trigeminal vascular nociceptive pathway, also the trigeminal cervical complex, rostroventral medial medulla. I mean, all these sites that when we talk about acupuncture and neurophysiology, that we cover those as well. But those go awry with something like acupuncture, and it can be triggered, whether it's a smell, whether it's a bright light, stress, something going on in your head, some pain, whatever. So just this study is looking more at the how to change the brain's behavior. But again, a lot of it is instigated by chronic stress and anxiety, and that might even result in myofascial tension, etc. Here, just going back to looking at preoperative anxiety, a meta-analysis, we've seen a lot of this now. Acupuncture therapy aiming at reducing preoperative anxiety has a statistically significant effect relative to placebo or non-treatment conditions. So again, why aren't we doing that? And probably many of you are veterinarians, but when you have an anesthesiologist that is also an acupuncturist, there's a lot of great stuff that can happen perioperatively, which with this paper here, we're talking perioperatively instead of just preoperatively or postoperatively. You are dealing with the whole before and during and after period, and how acupuncture can improve and accelerate uh, out improve outcomes, accelerate recovery by including acupuncture in this continuum. And that's where they're coming up with this novel concept of perioperative acupuncture medicine to focus on the optimal treatment in the perioperative period. And again, if you're reducing the amount of medications required, especially opioids, or and with all these drug shortages or things just aren't being made, we do have to be more creative a lot of times. And so there are ways to change the nervous system, upregulation, so we can downregulate it with acupuncture. We can reduce pain. We can help maintain and more quickly restore digestive function. And then you're not going to get those opioidergic negative effects and the nausea and all that. And just be mounting all these drugs on top of each other to deal with the problems of other drugs. It just makes so much sane sense. But then we might hop off on the other track and think about, well, who's guiding medical care and choices and costs, and how much is there an incentive to increase the bill, to use more drugs, all that stuff. And so again, you run your own ship, or you have the ability to say what happens in your hands and through your license, then you can make your own decisions and better decisions on behalf of your patients. Now, this one is auricular acupuncture versus progressive muscle relaxation. You tense up, hold it, and relax. Tense up, hold it, and relax. So that's progressive muscle relaxation, but you do all over the place. Takes a while. But anyway, they're looking at ear acupuncture versus that treatment and finding in patients with major depressive disorder or anxiety that they were about the same outcomes, but I guess it depends who's around and what you're doing. You couldn't really probably that easily, or I wouldn't want to probably stick needles in my ear. I'd probably rather do the muscle relaxation. But if you're if you got 20 patients, you can pop some needles in and it's really fast. So anyway, they're about the same, but it's equally effective ways to deal with anxiety and depression. So that's pretty cool. And how does that work? Well, the doggy ear is going to be different than the human ear, but they have an auricular branch of the vagus nerve right in the middle part of their auricle, and ours is more in this part and down here. So you do have a branch of the vagus that will help to neuromodulate your depression and anxiety. Here we are back with yin tong. So over and over, same kind of thing. Preliminary review, systematic review, mentally stabilizing, and just reduce anxiety in your preoperative patients, have better outcomes. Some of you or people or dogs might have insomnia because their stress just doesn't shut off in their brain. So here's a randomized controlled trial of acupuncture and being able to use that instead of medications, because medications can leave you groggy the next day, and it's just not great. Why don't we use our endogenous pharmacopoeia? So The methods, just 72 patients, acupuncture group, or sham acupuncture treatment given 3 times a week for 4 weeks, and wear sleep monitors and all that. So acupuncture treatment was more effective than sham acupuncture in increasing quality of sleep and psychological health. And here's another one on the mechanisms, the acupuncture effect on glutamatergic neurotransmission in depression, anxiety, schizophrenia, and Alzheimer's disease, frontiers in psychiatry. So all of these pretty much are free for download, free online access, especially Frontiers is, and so which is pretty cool. So all kinds of neuropsychiatry disorders, whether it's degenerative or your depression and anxiety, and looking at the evidence and showing that treatment effects of acupuncture seem to have a common theme, and that's that it's going to regulate this dysregulated glutamate system. Remember, glutamate is an excitatory neurotransmitter, and drives you crazy. So versus glycine is inhibitory. And so, and I'm seeing a question from my friend Deanna. How do you balance doing the acupuncture with the stress that may be present if the patient has needle phobia? Great question. Well, and that's where acupressure comes in, or laser acupuncture, probably for the main two there. So there are studies just on acupressure. So we'll run across a little bit with the laser as well, but then we have to think maybe too, why do they have needle phobia? And have they ever had acupuncture before? Is there a way, because I can do acupuncture really, really benignly. And then I was like, oh, okay, that wasn't so bad. But it matters sort of like what their resting autonomic tone is, because people that I see that I make lie down after I do a demo, like at the course, they have a high resting sympathetic tone, and that's where just a teeny little acupuncture can just make them start to get sweaty, and it's because it's autonomically neuromodulating them, so you're having all these vagal effects. So there's a way to help them get over it, but there's also just ways to do acupressure. I mean, just even like this, there are lots of studies on acupressure for preoperative anxiety and different things. So good question, though. Thank you, Deanna, on that as always. Reducing anxiety and improving engagement in healthcare providers. That's us, right? Through an auricular acupuncture intervention. So again, becomes even more important now. We know with all these essential workers, healthcare personnel, with the COVID, and this one is considered the Valium point. It's just, you see there's this triangle here, and it's right at the tip of that. So I like, and thank you Shutterstock for these stock photos, but at least they had one that was fairly accurate, because they got all kinds of crazy things that aren't even doing anything. But this one is an anti-anxiety point, supposedly. But this whole region is what's supplied by the vagus nerve. So, and then we get trigeminal and upper cervical nerves. I mean, they're all cross-talking with the vagus, so maybe it doesn't even matter. But anyway, so here they're looking at the study participants, which are the healthcare providers, and seeing how over a 16-week period they got 5 treatments utilizing the NADA, which in Bostonian is how I would say my name. My name is Nada, but I have to say the R now that been away for a while. So National Acupuncture Detoxification Association is the NADA protocol for treating emotional trauma, and they do that for drug addiction, all kinds of things. But here they're doing it just for relaxation, so it has a calming point. It's been studied quite a bit. Was used very heavily in Lincoln Hospital. I think that's in the Bronx for drug addicts and all this stuff. Anyway, significant reductions were found in state and trait anxiety, as well as significant increases in overall scores on the work engagement scale compared to baseline. So seems to help. I mean, you are helping take down all this stress, anxiety, overwhelm, and giving some parasympathomimetic effects to these very stressed out healthcare workers, and giving them, more engagement with their work and increasing their productivity. Here we're back to heart 7 right there. And that's effective single point acupuncture in the prevention of test anxiety. So back to that, but this was just one treatment with test anxiety. And, they said, yeah, it helped some, but it was only one treatment. So that brings up the idea that it's best to have ongoing care. So whether you're going to get massage or acupuncture or whatever, do exercise, it's about a different style of life. This is about having enough room in your life that you are able to take care of yourself better. So acupuncture for anxiety, so on and so forth. Just the quality of research examining the use of acupuncture in treatment of anxiety is extremely variable, and we've seen some of that. But still, against this, the volume of literature, consistency of statistically significant results, and the wide range of conditions treated and the use of animal test subjects suggests very real positive outcomes using a treatment method preferred by a population of individuals who tend to be resistant to conventional medicine. That should sell you. All right. And then psychiatry, drug addiction, etc. So get off the meth, get on to acupuncture. That's the take home point there. Okay. Massage. Oh, and laser. There's laser acupuncture. We'll do laser first. So laser acupuncture in alleviating chronic insomnia. And this, we see some similar points to what we've had before. So we saw many of these before, in the addition of DO, which is GV20, different names from different eras of acupuncture coming over to the West. Anyways, so for Deanna, this is where they were, comparing results, comparing inputs, and either you got laser acupuncture, so laser shining on points, or a control group, which is always interesting as well. And all three groups showed an improvement in the score. However, only the ones with the robust treatment got the significant reduction in sleep onset latency, so they were able to reduce their stress and get to sleep. Now, interestingly, with laser as well, transcranial photobiomodulation for major depressive disorder. So here I have, this is an LED. It's not a laser, but this is where you're shining it right through the bone. Use transcranial. So photobiomodulation, this, as you can see, probably is a red light. So it's around 650 nanometers, but it's this kind of thing. Like, and where are you going to shine it? So I love transcranial photobiomodulation for my patients. I don't do it so much on myself. But especially with the class 4 device, I would worry a little bit about what are you doing to the brain tissue. So I'd cut down the intensity for sure on that. But here we're doing transcranial photobiomodulation for depressive disorder, targeting brain metabolism, inflammation, oxidative stress, and neurogenesis. So you're actually working to change how the neurons are functioning, doing their day-to-day productions of neurotransmitters and their activities of daily living, and their generation of factors and inflammatory or anti-inflammatory cytokines, the oxidative stress that can be affecting the mitochondria, and how the mitochondria are managing your reactive oxygen species, just the free radicals, free oxygen, the reactive oxygen species again, but just in terms of that oxidative phosphorylation and and keeping things in a homeostatic manner, as well as neurogenesis, so neural repair. And based on the data, and when you see this, if you want to look at it in the video or on PubMed, you can pause it here. But photobiomodulation appears to be a promising treatment for depression that is safe and well tolerated. And looking at the mechanisms, and this is by Mike Hamblin, who's at MIT, Wellman Center for Photomedicine, and just really worthwhile reading, looking at near infrared light. So that's going to be probably in your 810 nanometer, applied to the forehead where you don't have hair and whatnot. But anyway, even to the extent of having helmets on your head, like you could have for LEDs to stimulate hair growth. So that's definitely worth some investigation if you have patients with cognitive decline, or just their brain isn't functioning as well as it should, or if you want a little boost. Now, moving into the massage, effective foot reflexology on anxiety, pain, and outcomes of labor in prima gravida women. So anxiety, pain, this whole baby having thing. And foot reflexology is It's a way to apply pressure to the foot for sure, but this whole map of the body on your foot has no validation to it. So essentially getting a foot massage and showing that the results of the study showed less labor pain intensity, anxiety frequency, increased APGAR scores, so the baby came out better. So anyway, using this non-invasive technique, obstetricians can achieve to some extent one of the most important goals of midwifery as pain relief and reducing anxiety, because you don't want to be pouring drugs into a pregnant woman while she's having a baby and affect the baby. So again, another study. This is with Cochrane database. So they like to disavow a lot of stuff, and showing massage, warm pack, and thermal manual methods can have a role in improving the emotional experience, reducing pain, reducing anxiety. Here, chair massage, partner massage, on perinatal mood, anxiety, and pain. So seeing around the birth giving period that you are able to have people work with each other, and then we can think, what about people working with their animals in veterinary work? Back massage to decrease state anxiety cortisol level, so increase sleep quality in family caregivers of patients with cancer, a randomized controlled trial, and showed that family caregivers for patients with cancer can benefit from back massage, so helping the caregivers again. And oncology nurses can take advantage of back massage as an independent nursing action to support caregivers for patients with cancer. Everybody needs a massage, and that's just a given. But then, so remember the ladies having the babies. So they had the babies, and now they have to massage them and introduce them. But it also helps with the brain development and just building those connections, sensory and motor. And here, when they're kids, the impact of massage and reading on child's pain and anxiety after heart surgery, a pilot study, and seeing that with massage, that scores were lower for the need of benzodiazepines and preventing postoperative complications such as delirium through non-pharmacologic interventions. So children receiving massage therapy had significantly lower state trait anxiety scores than just getting reading done for them. Again, back massage, slow stroking back massage before you get before you get a cataract surgery. How about that? Mm, that should be routine. Somebody going into your eyes like that, and you get a back massage. Based on the results of the study, slow stroke back massage, low cost and safe, significantly reduces anxiety in patients who are candidates for cataract surgery. Yeah, that's a no-brainer. And then Tiffany Fields, who's one of the leading massage therapy researchers, had put this out several years ago, Massage Therapy Research Review, and just looking at a lot of her own research on preterm infants and people with fibromyalgia, rheumatoid arthritis, and all this, it is pointing to this increased vagal activity, the parasympathetic effects of moderate pressure massage, and the decreased cortisol levels. All is helping with emotional neural regulation with a lot of overlap with acupuncture in the neuromodulation realm. And then we have our botanicals, herbal triplet in the treatment of nervous agitation in children. So, in our botanical course, we go into an in-depth look at the pharmacology of a lot of these because you have St. John's wort here. And if you took my course, you'd know right away, or if you've been in my classes, and I just talk about this a lot, where there are big potentials for drug herb interactions when you have St. John's wort on there. Valerian root, passion flower, commonly used for anti-anxiety help, but you can't just assume this is like giving a bowl of Cheerios. These are pharmacologically active ingredients that have pharmacologically active effects that may not be appropriate for everybody. Then, of course, there's cannabis, which can help quite a bit with anxiety and sleep. Evidence is mixed because you have so many different types of strains of cannabis with the different terpenes and flavonoids and cannabinoids. So this study was just looking at what is the ideal entourage that will help with anxiety. And of course, we know that that cannabis, the THC part anyway, works with the endocannabinoid system. The CBD and other cannabinoids work with other endogenous systems. But anyway, herbal medicine for anxiety, depression, insomnia, lots of opportunities. Even you think about chamomile tea. I know that's super effective for me. I mean, there's so many things that you can do that are just at the grocery store from an herbal and food medicine type approach. So just showing that there are positive findings with herbs, with acupuncture, with massage, with photomedicine, fewer adverse effects compared with conventional medications, looking at things like black cohosh, chamomile, which I just mentioned, chasteberry, lavender, aromatherapy, or internally conceivably passion flower, saffron, useful in mitigating anxiety or depression with favorable risk benefit profiles compared to standard treatments. Why isn't this taught in medical school? Why isn't this taught in veterinary school? And then, of course, there's exercise. Modulates the interaction between cognition and anxiety. Take home message there from these various studies is that exercise, and especially if you have a lot of anxiety, more robust, like just more activity, like being more active rather than just going really slowly, that can help you quite a bit. Older patients with chemotherapy, anxiety, and mood disorders, that structured exercise can help them. Chronic fatigue, generally benefit and feel less fatigued following exercise therapy with no bad effects. So getting those animals out, and if you have a cat, getting them out however you can that's safely, instead of being home all the time and not doing anything and just having bad behaviors as a result. Physical exercise for chronic pain, we know that. So that's going to be part of our integrative rehabilitation. Moving to beat anxiety, epidemiology, and therapeutic issues. So how can we design proper exercise protocols for it, for animals, for humans, whatever? Community deliverable exercise and anxiety in adults with arthritis and other rheumatic diseases. So exercise is associated with reductions in anxiety among adults with selected types of rheumatoid diseases. So, the take home message for you is if you are having so much stress and having anxiety, don't you think you need to get out there and exercise? You need to go get a massage when it's safe. You can do some acupressure for yourself. We have photomedicine. We can do lasers on those points if you don't want to stick needles in yourself or don't know how. So just I hope that this gives you a feel for this not being frou-frou, but exercise can be useful. All these things from so many different modalities, that there's help out there, that you don't have to just suffer, that you can find out how well you can feel, how good you can feel, and how much more alive, and then that will then inform you on how you can change your life and make better life choices. And then here's that really good news that I mentioned at the beginning that I had, that even though we're talking about acupuncture and massage and photomedicine, so we have devices and we have needles and getting out and then to an extent with herbs, but the things, the physical medicine approaches, they're fine. But what they really do is they're just helping what you already have, your internal pharmacopoeia. So all these different ways that we can work with a system, the pharmaceuticals endogenously, they're already there. You have these receptors and receptive pathways that will trigger your whole state getting better if they're just managed appropriately and if the healer or practitioner knows how to activate them, because with sickness and stress and anxiety we get off kilter, but there are ways to get you back so that you're maintaining your own homeostasis and you're not relying on drugs that are causing problems. So there's no place like home, and there's no pharmacopoeia like the one inside of us. And that's it for today. Thank you for being here. I'll see you next time.